Well, welcome to the Experience Better video podcast series. I'm Josh Beekler, PT, and with me today is Liz Weber, a speech therapist here at the Children's Rehab Center. And today we have Kai with us, who's a little over a year old, and we're going to talk about some eating and swallowing, and then talking a little bit as well. So probably better start with eating because that's what we're currently ready to roll with. So what do you think, buddy? Should we do mac and cheese first or Cheerios? Which one? This one or this one? Yeah, mac and cheese.
So at the age of around 1, typically children are eating just whatever you're eating as a meal at home. With depending on how many teeth that they have, like mac and cheese is a great, it's softer. They don't have to really chew quite as hard. And kids actually are really good at gumming up almost anything, regardless of how hard it is. So again, they should be eating whatever you're eating, a variety, introducing a variety of textures, consistencies, flavors are really big for kids at this age. Like Kai is doing, some of that self-feeding is really important.
Self-shoveling is okay
yes,
too? Okay.
That too. He's doing a great job of managing it, as we can see.
He also likes putting his feet up on the table. Is that anything?
That might be
something else?
that might be a different therapy. But yeah, so when we're looking at again, just providing those various textures, consistencies, from the speech side, what we're looking for and assessing is like opening mouth. He's able to consume it, chewing it. His mouth is clear, and then able to, there's no coughing, no choking. He doesn't really seem to be struggling with it, which is typical. If your child has more, just doesn't seem to really manipulate it.
Right.
Thanks, bud. Whew, that's a good drink, huh? And or has like coughing and choking, then that would be a good reason to kind of reach out and see what we can kind of do. I can assess that and figure out different plans and what we can do.
So you kind of alluded to several things. It might be the motor phase of him opening and closing his mouth, or it might be, there's different phases of the swallow, and it could be any number of one of those, and that would be what you would diagnose and determine is like which phase of his swallow is the issue, and what we need to work on, and then provide interventions accordingly. So
yes, exactly.
Very good.
And then with like drinking, very important, just as well as feeding. So drinking at this stage at a year and older, they should be off of the bottle. Good transitioning would be providing like a sippy cup that Kai drinks. Introducing and using like what we would call the open face cup, so just your standard cup.
A disaster.
It could be, get ready to wear it too.
Right.
But it's always good just to introduce them to get used to that as well. That builds good, strong oral motor strength. It builds that coordination to transition up to when he'll be doing it by himself.
Right.
So good, able to see him tolerating it is great. And another transition going from like sippy cup to like the open face, you can introduce with the straw too.
Oh, sure. Yep.
Because generally what you're getting from the sippy cup is modified on like how much they're getting because of there's only just slight slits in here, so he's not getting a whole lot compared to when you drink with an open cup. Then you get lots of water.
You got lots of
You're
water.
able to get a lot, so like the volume of water, and so sometimes that can trick kids up and make them start kind of coughing or choking because they have to have the coordination and the strength to kind of manage that. So straws can provide that. Straws give you an increased bolus size or amount that you're drinking.
Sure.
So all of these are good things for him to be doing, and you're managing just fine, huh?
Yeah.
Say eating's good stuff.
Very good. All right, so that kind of covers the eating and swallowing. So as far as talking, what should he be doing at about a year?
Okay, so at a year, generally, yep, you're gonna hear that boy.
Yeah, a lot of that.
You're gonna hear some of those beginning babblings,
Or
you know, or
grunting.
like grunt. Hey, you're communicating, aren't
That's
you?
right. That's right.
Dad knows that you needed that, huh? You're ready for more. So some of those beginning sounds, so like your M's, B's, P's, N's, HW's, those are like what we consider our early age phonemes.
Okay.
And so, you know, having him producing those just kind of in babbling, you know, his babbles are gonna be longer.
Right.
To be more of like how we typically speak in conversation, sentence level. So more babbling. He's gonna show some of that intonation. Prior to recording, he was singing, and that was fabulous.
Yep.
And you'll see that more of, you know, like if you're interacting, just talking with him during play is huge.
Right.
Around the 1 year mark is when he'll be starting to say or trying to say more words other than just like mama, dada, you know, those really early babbles and words. So, you know, he's gonna be, you know, he might give you like a ba for like a ball. You know, he's, you know, at this point you can teach him more like more, please.
Yeah.
Those kind of things, just, you know, or like even just like a more or done, you know, something like that to kind of help that early communication.
Yeah.
So we can get those needs met. You know, and you can elicit that again by play, conversation, talking about what you're doing, you know, talking about what you're eating. You know, when he's grunting and reaching, it could be like, oh, did you want more?
Right.
And then, you know, he was doing that, you know, and that could be him saying like more, you know, that's the beginning.
Sure.
So yeah, there's not a ton of true words right when you turn 1, but between that 1 and 2 year range is when you're really gonna start hearing more.
Gotcha.
And they're gonna be able to kind of attempt more words, or you're gonna be able to see that they're trying.
Sure. Yep.
To speak more.
Well, very good. Very good. Well, if you have issues with any of those things, you can certainly reach out to Liz here at the Children's Rehab Center, especially when it comes up to anything speech or swallowing. So we're here for whatever it is you need, and give us a call and
we'll do it.
All right, sounds good.
All right, thank you.
Good job. Yeah, you want more?